Well, good afternoon, everyone. This is a very happy occasion, and Charlene and I are very pleased to announce that we have some good news for the city. I'm announcing today the appointment of Dr. Herminia Palacio as our new Deputy Mayor for Health and Human Services. I want to welcome Dr. Palacio to the administration. As we have named key figures in this administration over the last 2 years, we take the occasion each time to reiterate the goals, the values we bring to this process. And it's important to say it again. We believe in creating an administration that is fundamentally progressive in its values, and therefore we look for talent that shares those values and has been effective in implementing progressive values. We want an administration that reflects all the people of New York City, all the people that make this city great, and we always fundamentally believe in experience and effectiveness in previous work. Once again, we're confident that we have put all of these factors together and found a great leader to add to our administration. This position, Deputy Mayor for Health and Human Services in New York City, is clearly one of the toughest, most rigorous roles in local government anywhere in the country. And it takes someone with extraordinary capacity to handle it. Deputy Mayor for Health and Human Services will oversee 8 agencies, including the country's largest municipal health system, and agencies that employ thousands of our city workers, have combined a budget in the billions and make a huge impact on life in this city. Just as an example, the public health system, the Health and Hospitals Corporation alone has a $7 billion budget. So that gives you a sense of the magnitude of the role that Dr. Palacio is stepping into. Given that we were very focused on getting the very best person for the role, we conducted a national search. I spoke to leaders all over the country and experts in health and social services looking for the right person. And I am extremely proud to say that Dr. Palacio came through that search with flying colors. She is a nationally important figure in the area of public health. She's a seasoned leader in the area of emergency preparedness and response. And she's a person throughout her entire life who has been firmly committed to fighting inequality in all the work she has done. Now, Dr. Palacio from the beginning saw as her core mission lifting up underserved communities. And the origins of that mission and that sensibility come just from one borough away from here in the Bronx, where Dr. Palacio was born and raised. This is an auspicious moment for this administration, because with the addition of Dr. Palacio, I can now say we have 4 deputy mayors who are all born and raised in this city and have shared the experience of this city throughout their lives. And I want to thank First Deputy Mayor Tony Shorus, Deputy Mayor Alicia Glenn, and Deputy Mayor Richard Bury for all being here with us. The scorecard goes 2 from Manhattan, 1 from Brooklyn, 1 from the Bronx. It reflects all the greatness of this city. I also want to take a moment to say this was an extensive search, as I said, a national search, and I want to thank our Director of Appointments, Rachel Lauder, who played a crucial role in pulling this search together and seeing it through to successful completion. So thank you, Rachel, for your great work. Just going to give you a quick overview about Dr. Palacio before you hear from her directly. I'm then going to give you a quick update on a related matter before we go into Q&A. Dr. Palacio, as I said, born and raised in the Bronx on Clay Avenue to an immigrant family, and this, you're going to hear a pretty classic New York City story here, an immigrant family of humble means that at the same time dreamed great dreams for their children. Her father was a shoemaker with an 8th grade education. Her father, when he got to this country, became a cab driver and then later a bus driver. Her mother was a seamstress who later became a postal worker and then for 20 years got a job with the MTA selling tokens in the New York City subway system. Well, that'll immediately separate those of us who remember tokens and those of us who don't. Again, a classic New York City story, but also the American dream here. A family that believed that they could find something better in this city, in this country, and dreamed of what it could mean for their children. Well, here's what it meant for Armenia. She first went to PS 53, on 168th Street, and she was a young child of great promise, worked her way to Bronx Science, from there to Barnard College, from there to NYU School of Medicine and Mount Sinai. So her formal education is outstanding, but her informal education, the things she learned growing up in the Bronx, are at least as important. The things she learned with her first job bussing tables at the concession stand at the Bronx Zoo. And what she learned later, and this, we're going to date you again here, Armenia. This one's wonderful. She learned at her job cold calling people for family portraits at Gimbels. Take a poll of how many people remember Gimbels. She did all the hard work. She learned the life lessons, and it made her who she is. And I mentioned her father, a cab driver, her mother, a token seller. By the next generation, Herminia, a doctor, her brother, a lawyer. So such a great example of a family committed to their children and seeing the dream through to completion. Now, Herminia, obviously a true New Yorker. And when she went to her beginning of her career, it was in San Francisco, and she thought it would be temporary, but it became a number of years. And she had a very illustrious career in San Francisco, first at a public hospital, then as one of the leaders of the Department of Health. And that was a very painful and difficult moment in San Francisco as the AIDS crisis and the AIDS epidemic was fully coming to bear. Herminia was at the front line in that fight and played a crucial role in developing the strategies that San Francisco used to address AIDS. I will now call you Dr. Palacio for variety. After that, Dr. Palacio went to Texas, to Houston, where she was an attending physician at the Veterans Administration, Medical Center, before becoming the Chief Public Health Officer for Harris County, Texas. Harris County is a county that includes the city of Houston, so the total size of the county is about 4.4 million people. So it's one of the biggest counties in the country, the third largest after LA County and Cook County, Chicago. And the public health role there proved to be extraordinarily intense and challenging. Issues like West Nile outbreaks, natural gas disasters, and most pointedly, the responses to hurricanes Rita and Katrina. Dr. Palacio will tell you she got a call at 5 a.m. as Hurricane Katrina was ravaging New Orleans, saying that refugees from New Orleans would be coming to Houston, most likely not by the thousands, but by the tens of thousands. She was charged with creating the health apparatus to shelter these refugees. She had until 11 p.m. that day to achieve it. She put the system in place, and her colleagues set up a shelter capacity at the Houston Astrodome in 12 hours that ended up triaging 65,000 evacuees and ultimately housing 27,000 refugees from Katrina. She then led the public health operations for that shelter capacity, from mass immunization efforts to maintaining safe sanitation. She worked with county agencies, with the city of Houston, with federal agencies, and commanded a crucial public health element of the equation that had to treat any and all problems as they emerged. And that was through 2013. In the last few years, Herminia has come back to this city and has been living in New York City while working at the Robert Wood Johnson Foundation, focused on the needs of the future in public health and public service, developing a network of new leaders to build a national culture of health in cities all across the United States. Dr. Palacio has done great work all over the country, but her heart has always remained in New York City. And she now has the opportunity to serve all 8.5 million people of this city with the exceptional capacity she brings. It's obvious that she has a tremendous background in public health. As we know, this role also focuses on the human services side of the equation, and here is an area where she has a lot of perspective as well. Because in all those public health settings and all those clinics and hospitals she worked in, she saw the extraordinary challenges that people face. She saw the effects of poverty, she saw the effects of homelessness, she saw the whole range of social service challenges. And from the beginning of her life, she has seen her mission, beginning of her profession, I should say, she's seen her mission as one of not only providing health care, but trying to treat the whole patient and all their needs. came down to something as simple as trying to figure out if she had a homeless patient, when and how to discharge them if they didn't have a home to go to. She knew people who came in with something as simple as a common cold, but she knew that if they were sent back out, they would not have a place to go. So she tried to find a way to work to not only cure the sickness, but help homeless folks to get the support and the benefits they needed. And as Dr. Palacio will tell you, she has confronted challenges in her own family that have fundamentally shaped her thinking. Her own mother, very sadly, suffered a psychiatric break when Dr. Palacio was 17 years old, one that her mom never really fully recovered from. One of the effects of that episode was eviction. And thank God that her mom had her, Dr. Palacio, and had her sister to keep her off the streets and make sure she didn't end up homeless. But it's an example of the fact that Dr. Palacio doesn't see anyone as separate or different or those people. She understands firsthand the challenges so many New Yorkers face. Now, we know that many, many New Yorkers don't have that safety net of a family ready to pick them up when they fall. And that's why we're going to use every tool we have, our public health capacity, our social services capacity, everything we have to help New Yorkers in need, to help folks who are homeless, to help folks who are poor, to help folks who don't have some place to turn. When it comes to homelessness, Dr. Palacio will bring a very personal perspective to this. She also understands the kind of innovative strategies that work across all of healthcare and social services, and she'll help us build upon the initiatives that we've used so far to get 22,000 people out of shelter, to serve 91,000 people, to help them from becoming homeless to begin with. She'll help us build on the Homestead initiative, which will allow us to reach homeless people every day and do the hard work of convincing them to come off the streets permanently. Dr. Palacio's background will be invaluable in helping us develop the best approach. We look forward to working with her every step along the way and look forward to all the contributions she will make to her native city. And she will be starting in just a few weeks on January 25th. Before I turn it over to Dr. Palacio, just a few words in Spanish. Me complace anunciar que la doctora Herminia Palacio será la nueva vicealcaldesa de Salud y Servicios Sociales de la ciudad de Nueva York. La doctora Palacio creció en el Bronx y ha pasado su carrera profesional cuidando a la gente de comunidades necesidades en todo el país. Ahora, ella vuelve a casa para dirigir nuestra labor por una ciudad de Nueva York más sana y más fuerte para todos. With that, it is my great pleasure to welcome our new Deputy Mayor and to introduce to you Dr. Herminia Palacio.
Thank you so much. Thank you so much, Mayor. It is incredible to be here with you. Thank you so much for this honor. Words cannot express my appreciation for the opportunity and for your very welcoming and kind remarks. Good afternoon, everyone. I want to begin by thanking my family, including my sister Cristina, who worked for the Human Resources Administration back in the 1980s, my daughter Selena, who is here with me, and my son Nicolás, who just flew back to college. Mis tesoros, lo quiero muchísimo más de mucho. Serving the people of New York is an incredible opportunity for me because it's home. It has always been home. Being here and being anointed as deputy mayor is a tremendous honor. Serving this administration who is so firmly, relentlessly committed to equity, to equality, to serving the most vulnerable, speaks to my soul in very powerful ways. So this is a responsibility that I cherish very deeply. You've heard some about me, about the mayor, but I realize that you're probably still thinking, but we don't know that much about her. Who is she? And I realize you have to know who I am. I have to reveal myself to you because I've been entrusted with a great responsibility and a great public trust. And I stand before you at the very beginning of a relationship to earn your trust. I grew up in the Bronx, born and raised. I had a wonderful education in the public school systems of New York, and I got an education walking to and from the D train and the 4 train on the streets of New York. I had to learn to be scrappy because at 10 years old, I was about 45 pounds soaking wet. These are things that taught me many things in life. When I was bussing those tables at the Bronx Zoo, I could hear my mother telling me that I needed to bus those tables with pride, with excellence, that no matter what job I did, I needed to bring my full self, be there present, do it proudly, that no job was too small, that no job should be shameful, that all work was good work. And coming from the Robert Wood Johnson Foundation, having that long trajectory and thinking about the type of collaborative, multi-sector leadership that we need to build a culture of health is an amazing stage to make this transition. Because health is not something that happens in the doctor's office or in a health clinic. Health happens where we live, learn, work, and play. Health is all around us, and we here at city government are especially privileged to be able to use the tools of government to improve the health of individuals and communities throughout our great city. My experience is largely in medicine and public health, but it's all connected. Physical and mental health, economic health, community health, they all come from the same sources of opportunity and equality. This is the philosophy that I've nurtured and held my entire life. It's played a role in many opportunities in my entire career. My experience with my mother made me a better person, and it made me a better clinician. It allowed me to sit in a room with a patient who was severely mentally ill and have that patient understand at a very visceral level that I wasn't afraid, that I didn't see them as other, that despite the frailties and that despite perhaps feeling broken, that I saw their essence as whole. I have one patient that comes to mind in particular. I was working in a San Francisco inner city clinic, and I had a gentleman come to me for a TB test. He only came for a TB test, but I had him captive, so I kept him, and I gave him a workup from head to toe. We discussed many things, and I learned that he was addicted to heroin. So I spent a lot of time talking to him about his addiction and what were the opportunities for him to try to treat that medical issue. At the time, he wasn't quite ready to hear, but I was relentless, and I pursued anyway. And when he called back for that TB test, we talked about it again. And when he came in for the final results, he said, "You know, Doc, I've been thinking about what you said." And he went on to be one of my longest-standing patients. He became clean and sober. He never used heroin again. And he was one of my favorite curmudgeons. He would always hold my feet to the fire. But he taught me something. He taught me never give up, never write somebody off. You never know when the stars will align, where the right intervention at the right time and the right moment for the right person can make all the difference in the world. And so I hope that here with this administration, we are here at the right time for the right people with the right interventions to make all the difference in the world. So I look forward to giving New York everything I've got to creating a healthier and safer place for us all. The city is already doing extraordinary things to lift up New Yorkers. As an example is universal pre-K, that may look at the surface like it's an educational endeavor, but from my perspective as a longstanding public health official, as a medical practitioner, as somebody who's dealt with emergency response, as somebody who's had to interact with many agencies in the public and private sector, as somebody who loves to know the evidence. I understand that that universal pre-K is not just about educational outcomes. It's about outcomes for that child throughout their entire life. It's about better health outcomes. It's about better opportunity for economic outcomes. It is about reduced chances with the criminal justice system. So with this one initiative, this administration is already doing so much for generations to come. I grew up in a family that understood the pain of losing a child. My brother was 12 years old when he died from a car accident. He died before I was born, so I didn't get to meet him. But in our family, we understood what loss was. My sister got hit by a car in her teens, and I've never seen such panic in my mother's eyes. And thankfully for my sister, it was just a small bruise, a small incision that needed to be healed up. But the mayor's Vision Zero means so much to me because I understand what that loss of pedestrian accidents are. So as I look at all of the initiatives and I look at the illustrious team that I get to join, I can't tell you how incredibly moving this is. It just doesn't get any better than this. And so with that, I too will say a few words in Spanish. Estoy totalmente agradecida de volver a casa con la vicealcaldesa de Salud y Servicios Sociales en Nueva York, la ciudad que amo desde el fondo de mi corazón, nacida y criada en Nueva York, nacida y criada en el Bronx. He estado comprometida a la igualdad y la justicia social durante toda mi carrera en el campo de salud. Para mí es un gran honor trabajar con un gobierno que se apoya en esos valores, dirigiendo un equipo distinguido que lucha cada día para mejorar la salud de todos los neoyorquinos, los nuevos neoyorquinos. Así que gracias. Thank you, Mr. Mayor.
Thank you very much, Dr. Palacio. Before we take your questions, I just want to give you a quick update. We talked about this the other day, but with the cold weather coming on, our Code Blue apparatus was put into place. Now, you remember in the days after I took office, we activated Code Blue, and we greatly intensified it compared to previous approaches. Our simple message to all people who were homeless, dealing with cold weather, or, by the way, dealing with a heat emergency as well, was that they would be welcome in any and all of our shelters, no questions asked. And that didn't matter if it was a single individual or an entire family. We instituted that policy 2 years ago with a very robust outreach effort to go with it, in which our Department of Homeless Services outreach workers and nonprofits we worked with would constantly go through the streets looking for people who needed shelter, working closely with the NYPD and EMS. That same apparatus swung into action in the last 24 hours and will continue in place so long as we're dealing with this frigid weather. So I want to give you an update that these agencies, working together with our nonprofit partners, cycled through the city constantly on regular rotations, including the subway system, and reached a number of homeless people who did choose to come in to either shelters or to our safe haven beds or to our city hospitals. So last night, 97 homeless New Yorkers came in for shelter or for medical care. 96 of those were voluntary. One was involuntarily removed to a hospital for a mental health evaluation. So I just want to give you that update from last night's excellent outreach effort by our city workers. With that, we welcome your questions on the appointment of Dr. Palacio and on the areas that she will be covering. Mara.
Dr. Palacio, welcome. Congratulations. Could you just tell us, and I understand you haven't really dug into the work yet, but what do you think that the city is doing wrong on homelessness that we need to fix? What are you looking at and saying we need to do this differently?
What I'm going to be doing is building on the incredible work that this administration has already put forward on homelessness and working in partnership with them to move the agenda forward. Homelessness is an issue that plagues not just this city, but many cities across the nation. It's an issue that was a longstanding problem before this mayor came in office, and unfortunately, it will be an issue that is likely not to be completely resolved because issues that take 30 years to develop don't go away in an instant, no matter how important and how much resources and how much work we are putting at it. These are issues that are complex. These are issues that are recalcitrant because there are system and structural issues throughout the country and economic issues throughout the country that make this work very hard. So what I'll be doing is working with the administration. And you heard a little bit about my experience in disaster response, so I think if I can reflect a little bit, that there are some lessons learned there that I think will be very important and a perspective that I will bring to this work. So disasters come in very many different shapes and sizes. Some happen overnight, like the earthquake, the Loma Prieta earthquake in 1989 that I experienced and had to go in to seek clinics. Some happen with a little bit of advance notice, such as hurricanes. Some breed disasters of their own, such as the break of the levees. But with all of these, there are some common themes to being better prepared and to responding. And these themes are actually quite relevant to thinking about the plight of homelessness, because in our city and cities across the nation, homelessness is a very pressing and urgent challenge. So we need situational awareness. We need to protect life and safety in the acute phases. That includes things like shelter and temporary housing. That includes things like the efforts for the outreach workers that the mayor just described last night. We need to know what our assets are. And so I'll be working with First Deputy Mayor Shoras and with Human Resources Commissioner Mr. Banks to really think and look as part of this 90-day plan to understand what our assets, not just within the cities, but the assets with our partners. We need to have an all-hands-on-deck mentality. We need to be able to understand that to solve this problem, we need to work outside of our traditional silos. We need to leverage those resources together so that the sum is greater than the whole of its parts. So those are the types of approaches that I'm bringing from the lessons that I've learned along the way.
Okay, other questions? Yes.
First of all, how many candidates were interviewed for this position, and what role did Peter Ragon play, Benny, in helping you settle on Dr. Palacio?
There were, again, it was a nationwide search. We talked to many people about potential candidates. We only ended up interviewing a handful of candidates. Peter didn't play a direct role. He knew some people who had known Dr. Palacio's work, so he helped us to connect with them. Questions? Yes.
Doctor, I'm wondering, just to follow up on Mara's question, is the city doing anything wrong on homelessness that you could specifically name for us?
We appreciate your positive question. Welcome to New York City.
You know, my answer to the question is every administration, this was true when I was running a department, this is true of all of the work that I've done. We always need to be looking for how we can do things better, not with an eye of casting, we got this wrong, but with an eye of here is where we are, taking stock, taking honest stock, and looking at ways that we can improve. So as I said, I'm going to be working with First Deputy Mayor and really looking at the 90-day plan, taking a deep dive, understanding what the landscape is, understanding what the situation is, and looking at where we continue to build our strengths. And if, in fact, the evidence reveals that we need to make some mid-course directions, of course, that's part of what we are promising to do, what we're engaging to do, is to make those mid-course corrections, because we're all dedicated to the same goal. Nobody's happy about seeing the homeless problem. We're all dedicated to the same goal. We want to make this better.
Just to quickly follow up, are you going to be one of the people who's responsible for hiring the new DHS commissioner, if that's the
Well, let me jump in on that because, as you know, the purpose of the review is to determine how we want to proceed. As I've said very publicly, my assumption is we are going to come up with a number of reforms in the approach of both HRA and Department of Homeless Services and how they interconnect. We work from the assumption that there will, at the end of that process, be the decision to continue having two separate agencies, and therefore there'll be a full search for a new commissioner. But that's going to be a subject of discussion, what the structural reality of those agencies should look like going forward. So I think it's fair to say that although we will be looking for names and looking for ideas about who could succeed, it's important that we first of all, do that entire review and come up with our long-term plans before nailing down the next person. Yes?
Doctor, you talked about your work, your emergency work after Hurricane Katrina. Anything specifically after that storm that applies to the job you're walking into now regarding homelessness in New York City?
Well, certainly that storm highlighted several things. One is that we need to understand what infrastructure is, right? That part of the long-term solution is making sure that you have resilient infrastructures and that you have resilient communities. So I think about things in terms of what can we do to improve the situation for people who are homeless right now immediately? What can we do to prevent people who are on the brink of homelessness from becoming homeless? What can we do to transition people who are homeless, but we've protected with sort of the immediate health and safety concerns? How do we begin the transition to more permanent housing? Permanent housing being ideal, supportive and transitional housing pathways along the way. And then how do we think more globally across systems and across structures to really harden infrastructures, to borrow a term from emergency management? How do we make them resistant to insults? That means resistant to economic insults. That means that people have to have good job opportunities as well as a home. So it's really thinking about this as a complex problem with multiple pathways to entry homelessness, multiple pathways out of homelessness, and how do we take a system approach working collaboratively to make sure that we've got systems in place that serve us not just right now, but for the time in the future.
Would you say Katrina response is similar to what we're seeing now?
It's a condensed response, I would say. What we had to do was in a very acute emergency situation, we had to develop a shelter that was the acute health and safety. We needed to protect people right then. We also needed to find people some longer-term solutions. That shelter was not going to be a long-term solution. We had to address the many concerns that the people in our care had that without which they couldn't find long-term solutions, right? We needed to have their health. We needed to address their mental health. We needed to make sure they had safe food. We needed to make sure they breathed good air. So they're not exact corollaries, but they're translatable skills, they're translatable experiences that I think will add a different perspective to the perspectives that are already here in this administration working on these issues. So it's a complementary contribution that I hope to make.
See, there's any others on this side, and then we'll go over to the other side of the table. Yeah.
I write for the Staten Island Advance, just to clarify why I'm asking such a specific question. But one of the things that Staten Islanders sometimes feel is that they often don't get treated with not the same level of attention, but there's a blanket approach to a lot of these services that are provided. And you've mentioned a couple of issues that are really important to Staten Islanders, for instance, disaster recovery. Obviously, Hurricane Sandy was a big issue on the island, and also the heroin epidemic there. I was just wondering if you could describe a little bit how you're going to approach dealing with a city that is so diverse, and especially for places like Staten Island that are a little less dense, and there aren't the same level of services there.
Well, I guess I can begin by giving you a little bit of more background about Harris County, which is where I spent 10 years in public service to understand that I have some experience with jurisdictionally complex issues. So Harris County is a county that had 1.5 million people living in the unincorporated county. It had about 2 million people living within the city limits of the city of Houston, and another 500,000 people distributed among about 30 other municipalities that were either in whole or in part within the city. So even more jurisdictionally complex than a single city with 5 boroughs. This was many independent mayors, many independent police forces, many independent school districts, many political jurisdictions that required an integrated and an attentive approach to local needs, even within the greater sum of Harris County. So without knowing the specifics to be able to address yet, I would say that my general approach and experience, I think, prepares me well to think about not just the city as a whole, but needs that there may be pockets of needs that may need to be targeted.
I'm wondering if you could talk a little bit about, this administration has really made a priority out of addressing mental health issues. So I'm wondering if you could talk about how you think mental health issues affect our current homeless situation, and to what extent will you be involved in some of the First Lady's work on addressing the changing the city's mental health system?
So I would say that mental health issues are crucial, not just in the issue of homelessness. There's mental health is important in criminal justice. And I can tell you from experience in Harris County, one of the best places to get mental health care, unfortunately, was jail. So talking about mental health services globally is critically important. I applaud the First Lady for making this initiative, and I offer myself to her to help her in any way that she feels that I can make a contribution.
And just a reminder that what my wife started and has grown into Thrive NYC with all of the day-to-day efforts among the agencies led by Deputy Mayor Bury really does cut across every piece of this administration. Because as we learned, and what you said speaks volumes, we learned very early on, it's easy to think of mental health through the perspective of the Health and Hospitals Corporation or the Department of Health. But so much of the actual connection that this city government has to people in need of mental health services happens in the Department of Corrections. It happens through the NYPD. And by the way, DOE, join in. There's so many. But, and because of Charlene's efforts and because of Commissioner Bratton's commitment, now we, I think, have over 5,000 NYPD officers who have received mental health training, and that's going to grow going forward. So what Deputy Mayor Bury has had to do is really cut across, yes, DOE and a whole number of other agencies as well. But there'll be a very close working relationship with these two deputy mayors because obviously Dr. Palacio brings a lot of great experience, and several of her agencies are going to be crucial to this strategy. Okay, go ahead.
Mr. Mayor, I'm wondering if you can explain the decision to reappoint Judge Laura Johnson to a 10-year term, given some of the concerns about some of her bail decisions.
She made that decision within, that we're talking about over a year ago, within the laws that existed. And I think she's a very respected and effective jurist. But we have to change that law. And this is a central point, and we're going to make it a priority. It's going to take a lot of work in Albany, but we must give judges the right to consider the dangerousness of the suspect in bail decisions, and we must give judges the requirement of considering dangerousness when they make decisions about any diversion programs. Coming over this way. Anyone on this side? Marsha.
Mr. Mayor and Dr. Palacio, I wonder if you have thoughts about how to deal with the street homeless, because both the mayor and the police commissioner have described as service resistant.
Yes.
If you have any thoughts on how the city should deal with it, and maybe get them into, or convince them that the shelters are safe, that they can provide services for them that will help them?
Let me start with just my perspective and turn to Dr. Palacio. Look, I think this is a very real issue, and it's part of why we want NYPD to have this mental health training, why Chief O'Neill has formulated a specific unit within the NYPD that will focus on street homelessness. We know that of that 3,000 to 4,000 people on the street, a lot of them are shelter resistant, and it may be accentuated, of course, by mental health problems and substance abuse problems. One of the best solutions is to constantly engage them and figure out what will work for them. We have done that too sporadically in the past. That's why Homestead is so crucial. It'll be constant engagement in whatever language they speak, figuring out what that path is for them. And by the way, we have good news stories. We have stories of people who came off the streets permanently, who accepted mental health support, accepted substance abuse services, got reconnected to their family, whatever it was that would solve the problem. We have experience of what works, but it takes a relentless approach. Second, the safe havens. which are something we didn't have enough of. We have 500 more beds that are coming online right now, will all be in place by June. But as I said, we will keep building on that effort as much as the need demands, because that's where you have a place that is more supportive and more reassuring to someone who's on the street. Not a big shelter, but a smaller, more intimate facility, typically in a house of worship that a lot of folks feel more comfortable going to, and that starts a positive process.
I would echo precisely what the mayor said, that really having a multiple-pronged approach is really important. This problem has one label, homelessness, but it's many different problems all in play at the same time, as complex as the individuals that find themselves. And we have to allow ourselves to bring to that problem a complex set of tools that we can mix and match to meet the needs, the very different needs of the different subpopulations within that broad, overarching label of homelessness.
Please.
Do you think that the Code Blue situation gives you a rare opportunity to convince people who might not otherwise come into shelter, who come in because it's cold, to convince them that the shelters can service them?
I think Code Blue plus Homestat is what's going to allow us to do that, meaning we've used Code Blue to get people to safety previously, but convincing them to make a bigger life change takes real work. I think Dr. Palacio's example of her patient who came in with tuberculosis and she had to convince to get off of drugs in the process is a very telling example. So to really sustain that effort, Marcia, to convince people to make a fundamental life change and give them the support that allows them to believe they can make that change, that takes the Homestat approach, the constant engagement. That takes the safe haven beds. Certainly for some people, that's going to require the supportive housing, and the 15,000 new apartments are going to be crucial. So I would argue that in the past we had some of the tools. Now we believe we actually have a full tool chest to really go at this problem. Grace?
Bernie Sanders is giving a speech on Wall Street.
Okay, this is going to be interesting how you bring it back to this topic. If you can do that, Grace, you'll get the award for that. We're doing this topic. We're doing anything related to Dr. Palacio's announcement. We'll see what we can do on that. Go ahead, Erin.
On the Code Blue and the homeless people brought in, do you know how that compares to past similar events? Is that more than usual, less than usual, about the same?
We will get you more background on that. We are making sure now, consistent with Homestat, to constantly count. We, of course, are working with a lot of structures as we receive them, and we're making a number of changes. So Homestat is going to be the biggest outreach effort the city's ever undertaken, or any city's ever undertaken, to the homeless. And one of the things we're adamant about, and you all have raised it very fairly, is what is the count on any given day or night? First Deputy Mayor Shorus, working with the city's operations office, is going to lead that piece of the effort to constantly count, to constantly check all the streets of Manhattan between Canal and 145th and other key hotspots in the other 4 boroughs. So consistent with that notion is the point that when we have Code Blue in effect, we're now going to consistently count the impact each night and publish the results so you know them. But I think in the past, even though there was a lot of outreach, I don't think there was the same focus on collecting the data and publishing it regularly. Yeah.
First off, are you going to move back to your native Bronx?
No, but I don't know. I'm in Manhattan now, and this is how committed a New Yorker I am. So just to put things in context, I work for a wonderful organization right now, Robert Wood Johnson Foundation, which is out in Princeton. And I moved from Texas to New York City and took on a 2-hour commute every day because New York is home.
That's love. That's love of New York City.
So you are living in Manhattan, so you are familiar with sort of some of the street homelessness issue that's come up. But have you, or do you plan to tour at all and check out some of the...
Oh, absolutely.
Have you done that already?
I haven't done that, or no.
That'll be part of the plan. Yes?
You say to a homeless person who says that the city shelters are unsafe or unsanitary or dangerous, and they say, I don't want to go to a place like that.
I think they have been for many years, and we have a lot more work to do. There's no question about it. There are some shelters, let's be clear. There's a wide range of shelters run by a wide range of organizations. And some are very well run, and some are more modern, et cetera, and some still have problems. There's no question. But I think the other part is, as you guys often fairly point out, perception versus reality. The perception certainly hangs in the air that some of them are not safe enough or clean enough. Earlier last year, 2015, you'll remember I directed our commissioner for the Department of Investigation to go through a number of shelters with the point of view of DOI, which is a very rigorous one, and give us a report on the conditions in our shelters so we could figure out what to do. We came back with a series of recommended changes, which we have been implemented. We came up with a repair squad, which at this point I think is between 70 to 80% of the violations we found have been resolved, and the rest we're working on right now. So the fact is there is a longstanding problem that must be addressed, and we're committed to addressing it. I think given both the reality and the perception, there's still going to be folks on the streets who are resistant. And that's where the safe havens are a crucial, crucial tool. Homestat plus safe havens are going to be necessary. And by the way, I think for some people, particularly with a mental health challenge, even if the shelter were pristine and totally safe, the size still might be alienating, and they would want and need a smaller setting that they felt more comfortable in. Again, a house of worship often provides that. So we're very committed to doing that work consistently and figuring out what gets people in off the street. 58,000 folks in shelter, a number we're going to work relentlessly to get down. 22,000 we have gotten out of shelter over the last 2 years. That 3,000 to 4,000 on the street, again, very different reality that they face a different set of realities for them. For them, I think, even as we improve shelters, I still believe safe havens are going to be more often the solution for them. Okay, last call, please.
Dr. Palacio, in terms of getting up to speed and your learning curve, can you outline a little bit what you envision for that in terms of meetings with commissioners and other such aspects of that?
Sure, I would say that the one word is deep dive and swim very fast. So situational awareness includes meeting people. It includes briefings. It includes looking at the data that we have available. It includes the opportunity to actually reach back to mentors that I've had, to contacts that I've had, to think about bringing other ideas to the table, because New York is wonderful, but I'm shameless about stealing good ideas that emerge elsewhere as well.
Do you have specific people that are on that short list?
You'll get back to him. Yes.
There were some reports that said that the administration was looking for more Latinos in office. I was wondering if you could tell us, did that play the role when choosing Dr. Palacio?
We did a national search to find the person that we thought could best do this exceedingly complicated role. And I think you're hearing over this last hour, you've heard a lot about why Dr. Palacio is the right choice, and you can tell as she speaks about these extraordinary experiences she's had, why she was head and shoulders above the different choices we had out there. Look, someone who has experienced the effects of Hurricane Katrina, the front line of the AIDS crisis in San Francisco, that alone would make a candidate exceptional. But the fact that she's born and bred in the Bronx, understands the life of this city, has our values, and obviously is passionate about making change, she was absolutely the right choice. That said, we're going to constantly be looking for talent from all the communities of the city, and we believe fundamentally in having an administration that looks like New York City, and that's an ongoing effort. We are constantly recruiting people from all different communities of the city. Last call. Yes, Rich.
Doctor, when did you get the news, and did you note that your heart rate began to accelerate? What was going through your mind?
He's always going to ask the get to the core of the matter human question. Did you start sweating when you were right?
I got the news last week, and yes, my heart raced and has been racing ever since, and I'm hoping that after this conference, the butterflies that have been occupying my stomach will finally leave.
Amen. The final word. Thank you, everyone.